training, and welcome to another episode of Dog Talk. Today, we're going to talk about veterinary care. So, there's a couple of things that people who have not had a lot of exposure to visiting a veterinarian with their pet, or people who are new dog owners and haven't dealt with a lot of health issues with pets in the past, could definitely benefit from knowing before having to go into more intensive treatments because they sooner or later will happen. So I want to talk a little bit about um, what you should look to your veterinarian for, how you should utilize veterinary care, what you're looking at cost-wise, what different types of veterinarians there are, and what the variants there will be in their recommendations. Some of the details of what still is standard and what's about, what is about, but what is changing. If you look at what's taught in veterinary curriculum now versus in the past, what's in the veterinary curriculum a little bit versus what's not in there, and just give you a little bit of an overview about how to make vet visits maybe a little bit cheaper sometimes, but also be more informed about how to approach it, how to deal with it, and hopefully make it a better experience for your dog and also most likely help the veterinary staff and the veterinarians themselves out in the process because they benefit if it goes smoothly as well. So first off, obviously every dog, like every person, you need a doctor at some point. Even if you're overall healthy, sooner or later you end up at a doctor with something. It's just going to happen. So to say my dog will never go to the vet, that's just not a position that will hold up. So there's things that needs to happen. Your dog needs certain vaccines. The dog will need certain treatments. You may need a warmer here and there. So there's things that just will need to happen with your dog. So when you have a pet, especially when you have a newer dog owner and you haven't been to the vet very often, it's a good idea to get your dog comfortable with the entire process of going to the vet and being there before you actually have an emergency. So when you have a puppy, you can include that in the training process. But even if you don't have a puppy, if you rescue a dog, many people do. A lot of my dogs are rescue dogs. Get them comfortable with the process of going to the vet when you have no need to be there. You can go in the waiting room and sit there a little bit. You can introduce yourself. You can tell them, hey, I'm new here. My pet has never been here. I'd like to sit here a little bit and get my dog comfortable, and maybe you can give them some treats. Most of the people in the veterinary offices and the front desk, they're super happy to do that. I mean, I've never had anybody saying, get out of here. When you tell them what you're doing, they usually appreciate it because they know it'll help them down the line if their dog's more comfortable with everybody. If you're up for it, you will have to pay for that. But if you're up for it, you can schedule just a routine exam with the veterinarian and then have your dog meet the veterinarian as well so they can get comfortable with each other and use that. That doesn't have to cost more than the exam fee if there's nothing wrong with your dog. But that's something you can also do, make an appointment and get your dog familiar with the process. And we have an article on the website that goes over all the different things that happen at a vet office that you can practice with your dog in terms of what parts of his body he should accept to be examined and touched and handled, that I recommend you read. And it's helpful to prepare your pet. But just like things like that help overall. So getting familiar. Now, another thing is you want to have a regular veterinarian you see for regular checkups and vaccinations when they're due and things like that. But you also want to look where in your area are the emergency vets that are open 24/7. Because dogs get into things and things happen. And oftentimes they happen at really inconvenient times in the middle of the night, 10 o'clock at night, whatever. So we just had recently something with one of our associate trainers. It looked like a dog was going to have bloat. We saw early stages, wasn't quite clear where it's going, but it was like something the vet needed definitely to take a look, and the dog had to stay overnight. So we needed an emergency hospital. And you can certainly look them up when it happens, but it's a good idea to know where they are, how far away they are there multiple options? You can call them while you're on the way and let them know, hey, I have a dog coming in with bloat. Please get ready. So there's all kinds of things you can do if you're familiar with the veterinary situation. So get familiar in your area with the different veterinarians that there are. Maybe you visit a couple and see how you like them. Some people like some vets and hate others. I had certainly experiences at vets that I didn't like, and I had veterinary experience I liked a lot. So it's just with people. Some people you like better than others. Find one that you really like, and don't hesitate to shop around a little bit. I had to switch my vet because it became virtually impossible to get in, and even with an appointment, it was like an hour wait time, and this was kind of before even COVID, so it was already bad then, and COVID just made it a lot worse. So, and I liked the vets there. It was really bad because I've been going there for a long time, and every once in a while, um, I may still have to go there for things, but it's no longer the office I go in the most because it became so difficult to just make appointments and even then not wait there forever. Became very unpredictable. Became like a day trip, pretty much, to go to the vet, and that doesn't work for me. So I had to switch vets, and I found another good vet, similar driving distance, but it's just some of the things to factor in. There's also businesses, and some are run better than others, and you may like the vet, but maybe the office isn't run that well, and you're dealing with that. So figure out which office is good for you, find a nice veterinarian you like, and then stick with them. Right? That's basically the best approach. So a couple on just the logistics and the administrative side of vet. The other thing to consider is what will happen if you have an emergency and the cost goes through the roof. Because it can, within minutes of showing up at the vet office, you're being presented with a bill of thousands of dollars. It's not unheard of. It happens a lot. Your dog ate something, twisted the stomach, gets into bloat, or your dog ate a medication that's poisonous, needs to have a stomach pumped out, stay there, gets detoxified, has to stay in the hospital overnight, thousands of dollars. Your dog was attacked by another dog out on a walk, thousands of dollars. I mean, it goes pretty quickly up there, right? So, and that doesn't even factor in specialty treatment, because there's pretty much every specialist under the sun that exists for us now, also for dogs. There's ophthalmologists for dogs. There is endodontists for dogs. There is oncologists for dogs. I mean, there's cardiologists for dogs. There's so many things in the specialty realm. If your dog has a health condition, it gets expensive pretty quickly. So here's a couple of suggestions. First, buy health insurance for your dog. Buy pet insurance. It's not called health insurance for pets. It's called pet insurance. And pet insurance, you can usually pick a deductible and then a coverage rate. How much do you want to have reimbursed? And you could include and exclude oftentimes the preventative care like checkups and vaccinations and so forth, and pick something that makes sense to you. So what I've personally done, because that works for me, is I picked the higher deductible, I think $750 per visit, and I only use my vet insurance when it's an actual emergency. When I have surgery or so, I don't need them to pay for standard care or an exam here and there or vaccination. I don't care, right? That's fine. These things don't cost much. I want this insurance to be in place when something bad happens that costs a lot. And it goes up there pretty quickly. So having that in the back pocket helps. So I take a high deductible. I have a 90% coverage rate, a reimbursement rate, and I pick the maximum amount per incident or per year that will allow me to insure my pet for. And 10, 12, 15,000 is usually the cap they have on these plans, but go with the highest one. So it can go with a spinal injury or so, which I've dealt with once. It'll go to that level. So it's don't save there. Get the deductible higher. That's the way to save on those rates usually. And most of these systems that I've seen now, you literally, when you sign up, you can like move sliders around. What's my deductible? What's my rate? What's my this? What's my that? And you can immediately see what the rate will be for your dog. It's kind of cool. So you can really plan it out nicely. The pet insurance I personally use is Embrace Pet Insurance. I had a great experience with them. They've always paid for the things that my pets are insured for when things happen. They never give me trouble. Another one I heard good things about is Healthy Paws. I have a couple of clients who use them. And another one that some of my clients have, I think it's Nationwide, is offering a pet insurance as part of their employer-based healthcare plans or things like that. And I have a couple of clients that also have used them and liked them, have told me they enjoyed the experience. So those three, I've heard good things about, and Embrace I have personal experience with. There's other bigger names that I'm not going to name them here because they're probably going to otherwise complain. But I had some bad experiences over the years with pet insurances, and I'm with the ones I'm with for a reason. Well, it's not the first one I picked up; it's my third one actually. But I'm happy. I'm happy with Embrace. So that is covering the expenses that you may incur, and it starts off usually with pretty low rates. So if you have a 1-year-old dog, you may pay, I don't know, $30 a month for insuring that dog, like fully well insured. And then every year the rate will go up somewhat because he gets older. So you can expect the insurance rate to rise by about $10 a year. The monthly insurance rate goes up. So if the first year is 30 or 25, next year expect to be 35, and then 45, and 55, something like that. So that's not an uncommon rate increase that you're going to see. And it's not unaffordable, and then it stops rising at some point in this realm. So when I had my Sylvester, he was 17, so it didn't keep going up in this $10 rate. I think once it was past 100, it went up like $2-3 a year, so it kind of stayed in that range. So it caps out at some point and increases in my experience. But I don't have a dog in that age group right now, so I don't know. But that's a good thing to have to keep yourself financially secure, and not to be standing at a vet office in an emergency situation and saying, I can't afford saving my dog's life. That is a horrible situation to be in. And I know there's care credit, which we'll talk about in a moment, but it's better to be prepared from the get-go and have this backup. Now, at the vet office itself, you do have to pay. They don't accept that insurance as a backup because they don't deal with that. They will give you the information to file the paperwork and get the money back, but they don't take the insurance. So you have to pay them. And there's now a couple of options to do that. So if you can, the best way of doing it is having a credit card that has basically a $10,000 limit with no annual fees and no expenses out of pocket whatsoever, and have that, put it away, and keep that for emergencies for your pet. That is the ideal thing to do if that's possible. I know not everybody can get a $10,000 limit credit card, but if you can get a credit card, even if it's not $10,000 limit, take advantage of an offer, make sure the credit card doesn't have an annual fee, and use that just for veterinary expenses in an emergency. And maybe have a couple of those. I mean, you can get maybe a couple with like $2,000-3,000 limit and have them as a backup. So now you are able to pay the vet in the moment and then get all that money back within a month, pretty much, from the insurance, and pay this all off. So you set yourself up for being able to pay at the vet and be ready, and with the insurance you get it all paid back. So you're not sitting on that debt afterwards. So there is something that you can do. It's not a credit card, it's kind of similar, but it's called Care Credit, and it's also available for people, but also for pets. And most vet offices offer that, and they will take that. So if you are prepared and signed up for Care Credit up to a certain amount, you can pay your medical bills with that, and then you pay them back. It's kind of like a home equity line thing, but it's not on your house. It's not a home equity line, but it kind of works in a similar way as a home equity line account. It's just a personal credit line versus a secured debt. So it's an unsecured debt, but you just pay it back that way. But now also you have access to funds, and then your insurance can wipe that out. So that's another option, but I would sign up for that if your credit score is decent enough, over probably 680 or something like that. I would sign up for that when you have your dog, and not in the emergency situation where you then don't know if it's going to go through or not. Sign up for that. As far as I know, that doesn't cost anything until you start using it, so you know you have it as a credit line available to pay for emergency vet bills. So prepare yourself, is my point. So now we covered the administrative side and the financials of vets overall and what we will deal with. One last thing on that is if you happen to be in an area like we are here in Southern California, we have a lot of rattlesnakes. California has 6 different types of rattlesnakes because Southern California is one of the most biodiverse areas outside the Amazon rainforest. So we have a lot of different varieties of species here. And with rattlesnakes, we have 6 different types, while the rest of the United States has one different type. One type of has one type of rattlesnake. Now there's other poisonous snakes in America. It's not that's the only type of poisonous snake, but here in Southern California, rattlesnakes is what we got. So with that, why am I bringing this up? Antivenom is the only thing that can save your dog's life with a rattlesnake bite. And knowing which doctors are open 24/7 and which doctors and offices carry the rattlesnake antivenom is important to know. Now, where I live here in my area, it's pretty much all of them, but it's a good way to check with the doctors you see and the emergency offices you may go to at night that they all do and always do. Because these antivenoms expire. They don't last long and they're expensive. So a vial of an antivenom last time I checked was $1,500 for one. And I think it's for 25 to 30 pounds of body weight. So if your dog's like a 75-pound dog, you are going to need 3 vials, and it's $4,500 right there. The price may have gone up. So this is not, don't quote me on those numbers. But that's kind of pricing you look at if your dog gets bitten by a rattlesnake. And there are some rattlesnake bites where the antivenom will not work. I think it's these, which one was it? One with a neurotoxin. Southwest Pacific, I think, but I'm not 100% sure on that. But there's nothing you can do at that point. Nothing you can do to a person either. It's just what it is. But the antivenom is the best move. Now, just quickly on that, with a dog, there is rattlesnake avoidance training. And we have a company we use and we recommend in the articles that we have on rattlesnakes on the website. They've trained all our dogs. And I highly recommend you consider rattlesnake avoidance training. Doesn't cost much, is quick, and you do a booster training every 2-3 years or so, and your dog will A, not get bitten by a rattlesnake, and B, warn you if there is one. So it's good for both of you. So if you go out there in nature, do that training. Last thing on that, really quick, the rattlesnake vaccine is worthless. Don't do that. It does not protect you. It does not protect your dog. They don't even offer it for people. It's just for dogs. And the only thing it does, it slows down the circulation of the venom. And that can be done with Benadryl. So talk to any snake handler. They will tell you what I just told you. This is not weird knowledge. This is very common knowledge that you can just do the same thing with Benadryl. And the vaccine is just, A, doesn't do anything. It's not helpful. And B, has a lot of risks. So probably one of the most risky canine vaccines there is. The standard ones, parvovirus, temporal rabies, and all that, they're not risky, really. I mean, too many of them would be, but they're not normally risky. But the rattlesnake vaccine has a lot of potential side effects, so be careful with that. I wouldn't recommend that. So that's rattlesnakes. Make sure that you know which clinics have antivenom in stock. Okay, so let's talk about the different types of veterinarians real quick. I mentioned there's specialists and experts you can go to, and that hopefully is never necessary, but it's good to know they exist. There's spinal surgeon specialists. I mean, there's all kinds of stuff. Right? So there's neurologists for dogs. But aside from these specialists that your vet would refer you to, if that became necessary, there is basically 2 categories of veterinarians to know. One are the classical, standard, traditionally trained veterinarians. That's the majority. And then the holistic veterinarians. That's the minority, but it's a growing number. So this is going to probably at some point become equal. It's a strongly growing field of holistic veterinarians. So what's the difference and what does this even mean? So the more traditional veterinarians will always have the standard medical care approach with annual booster shots, medications, tick and flea parasite preventatives, all the standard things that you will expect at most vet offices. While the holistic veterinarians will have alternatives that are often healthier and not less effective. So there are other things you can do for all of these things that I just mentioned. I mean, not vaccines. Vaccines are what they are. You have to get a vaccine. But for like parasite preventative and tick preventative and things like that, there are alternatives that are very as effective as the medications, and they have fewer side effects and fewer risks. And they're sometimes cheaper too. They're not always cheaper, but sometimes they are. So it's worth exploring. And it's worth visiting a holistic vet and just compare how you like the experience, how you like the recommendations and the treatments, and see something that resonates with you. Not everybody is for everybody, so pick one that works for you, but it's good to know that there are different vets out there, and explore when you visit different vets to find a good one. I personally always check with the holistic ones first. They're not like esoteric weird people, so don't think they're not going to give you standard of care. They absolutely will. They perform surgeries, they do all this stuff. They have veterinary training, they went to the same veterinary schools, but they have some supplemental training and additional understanding of the alternatives that exist for treating certain conditions that regular veterinarians have not spent the time exploring, because it's not what they learned in their original curriculum. There's some supplemental education that holistic veterinarians have taken on that allows them to do things a little bit differently. So it's my experience with that has been wonderful, and I would encourage you to also explore it. So a couple of things you're going to see in differences there that I think are important to understand. So dog food, we had a podcast just on that. And dog food, you're going to get far better recommendations and help and assistance with a holistic veterinarian. They oftentimes are also canine nutritionists, or they work with canine nutritionists to help you formulate food or find better food for your dog, while the traditional veterinarians basically sell you big brands like Science Diet and Royal Canin, very common in vet offices these days. But a holistic veterinarian approaches food a little bit differently and has more education around food. So in a standard veterinary curriculum, I believe it's about 40 hours on nutrition, and I believe it's a Purina booklet that comes out of, I'm not sure if that's still true, but a veterinarian told me this. So, but a holistic veterinarian has a much deeper knowledge of how to use nutrition and nutritional supplementation and food in general to maintain overall health better. So there is a huge difference in understanding of nutrition and food between those two groups based on just their background, their education, their veterinary school experience. And that's one of the differentiators. Another differentiator that you run into is with spay and neuter surgeries. And that's not so much a holistic veterinarian now, but now we're talking about board certified veterinarians here in contrast to the more common veterinarian. So the most common procedure that you have in America is that you have a spay or a neuter when you go have your dog sterilized. And they basically remove the entire reproductive system, and that affects the endocrine system. Basically removing it, taking it out. And that has an impact. It has an impact on hormonal production, has an impact on health overall in the long term, can impact growth if you do it at dogs that are too young. If the growth plates haven't closed yet, it's a bad idea. So, but that's the standard thing, is to do spay and neuter surgeries. That is what the traditional veterinarians are trained on. Now, a board-certified veterinarian is trained on doing vasectomies and ovarian sparring spays. So they're basically cutting the cord and tying the tube, just like you would do in a human counterpart, right? So they can do the surgeries that a human would undergo for sterilization versus what we normally do with dogs. So they can do the surgeries that do not affect the endocrine system, but give you the sterility. They'll cost a little bit more, but they avoid messing with the endocrine system, which has a lot of advantages health-wise in the long term. So that is something I generally recommend to my clients, and there is it's called the Parsamon or Parsamos Foundation that allows you to search for board-certified veterinarians. They are all over the country. They're not easy. They're not hard to find. And we have some on our article, My Thoughts on Spaying and Neutering. There is a link at the bottom. So if you look at that, you can see, I could find one in your area. There are, I think we have 4 or 5 in my area now. There used to be just one, and now it's a bunch. So they are around, and they just have better education around performing different types of more intricate surgeries. Now, in comparison, if you go to Europe, like Germany, particularly where I'm from, that's the standard. So you're not allowed to really alter dogs unless it's medically necessary. So the laws are completely different than here. You can't just do the things we do here over there at all. So it's like a lot of things are prohibited. And that's animal welfare concerns come from that. But so this is depending, because here this has become the standard. It's by no means the standard all over the world. This is just what America chose to do. But there are alternatives, and the board certified veterinarians who are the more maybe a better trained veterinarians who can do these other surgeries that these more standard vets were not trained on. And that's not a controversial thing. It's just different levels of education. Just like you have with human surgeons and doctors, they have different levels of degrees of education depending on what they're doing. So that's not a controversial thing at all. So know that. So there's these options. And yeah, so the same thing goes with vaccinations. So we have a whole vaccine podcast. I don't want to rehash this, but with vaccinations, holistic veterinarians are the ones that usually do titer tests in the house. You can do it themselves, and it makes it cheaper, makes it faster. And they will titer your dog. They will see if your dog has immunity. They will see if your dog even needs a new shot, and then just guide you more towards a different vaccine regimen that provides you the exact same protection with far fewer risks. Because there's side effect risks if you do the annual booster shot and a lot of these things. So it's not that the risk that comes from vaccines with dogs is giving them in general. That's not the issue. They're fine to provide protection, and you do need the core vaccine. So part of it is temporal rabies. You absolutely must do them. This is not optional at all. It's crazy, it's irresponsible to not do that. But the annual boosters for them are medically and biologically not warranted. And the holistic vets, they will just test your dog every 2 years or every 3 years, run a titer on his blood, and will tell you, hey, he needs a booster or he doesn't. And then you know for sure. Because the thing is with just doing it, you don't know if your dog actually has immunity. Going through the puppy shot rounds, right, the three shots that you get as a puppy, most dogs will have immunity after the third one. Well, a lot of dogs have immunity after the second, and some still don't have any immunity after the third. So there's people walking around out there with dogs that have no immunity to parvo and distemper, but they're having this illusion that they do because they never titered the dog. They just did the puppy shots and did the boosters, and they don't know that their dog never actually developed immunity. Same with us. I mean, I have a friend who's been trying to get immunity established. What was it? It was tetanus? It was something standard, and tried to get vaccinated and did, and they titered her, and she could just never get there. She could never get immunity. Her body is basically not allowing her to build antibodies for this. And she gave up. It was like 5 times. So it happens. It's not common per se, but it happens with people. It can happen with dogs. It can happen with animals. It's just the same in terms of us immunity systems. Good. So holistic veterinarians are more in the titer round, testing round, and then only vaccinating if actually necessary, and not just because time has expired. What else? So on other things with veterinarians, so annual checkups, it is generally a good idea to go in and have your dog examined once a year for just general things. Have the doctor feel him up, because that's what they do. They touch him everywhere, and check him out and take a look, so you can catch things potentially early. So it's a good idea to do annual visits, just a checkup, go in and get recommendations, if any. And even if it's just to being told, hey, your dog's healthy, that is awesome, right? Now, if you work with dogs like I do and many people in the industry, you begin to see a lot of things with dogs. You know what is a problem, what isn't. You know how to approach things and how not to. What will just cost money and not produce any relevant improvements. These are personal choices I wouldn't recommend to other people, but just expect when you work with a professional who works with dogs all day long, like a dog trainer or even a groomer or people like that, they may tell you other things that may or may not be right for you. You decide what's right for you. But when you see a lot, right, the first time I saw blood in a diarrhea explosion with one of my dogs, it was a big mess, but there was basically a lot of blood in there. The first time you see that, it's kind of like shocking. Like, wow, this is bad. Let's emergency vet. Let's go. Right? This isn't good. And then when you learn more about this and you see it again, maybe you wait and just maybe call a vet, do an emergency hotline thing. There's now Ask a Vet online and describe it, and then maybe wait till the next morning and don't spend the night in the emergency room. So you become a little bit more relaxed in your approach to things once you've seen them for a while. But for a newer dog owner or a less experienced dog owner, that is not something you should be doing. That is something once you've seen it 5-6 times, you're like, yep, that's probably where it goes. What to look for, and if you, yeah, I don't even want to describe this. Just understand the more people have seen and that they work with dogs, the more they may have other things they'll tell you. But you should always do what's comfortable to you and what you feel is the best approach for you. Some people are very comfortable with waiting a little bit and just rushing to the emergency vet if necessary. Other people go to the emergency vet every single time and spend the money. Do what's right for you, what makes you feel comfortable and you feel is the best approach. So, good. I think that was it. That was it. What I wanted to touch on the veterinarians. So I hope that was helpful. How to prepare yourself for the inevitable vet visits, and prepare yourself financially. Prepare your dog. Know what to look for. Branch out. Check a couple of vets out. Find a setup that works for you, and that's advantageous, and explore different options for overall health and care. There is a lot of alternatives out there these days that are often better than what is still the majority approach. So some things change slowly, right? There's a lot of, if you're a veterinarian, like in any high quality professional, there is a lot of research all the time. There's a lot of medical profession. There's studies all the time. There's research all the time. There's papers all the time. There's updates all the time. And it's really hard for a veterinarian to stay on top of everything all the time. I mean, yes, it's their job, and I'm sure most of them want to. But really, the latest research on everything is not easy for them because it's not just one species, right? So they're dealing with all kinds of species and all kinds of things that can happen with cats and dogs and horses and frogs and birds and spiders and snakes and whatever have you that people have as pets these days, and ponies. So they need to keep up on a lot of things with a lot of animals. And it is difficult for them, even for the best of them, with the best of intentions, to always know everything. So I'm sure it's very frustrating for them if somebody comes in and he's read a study and they haven't read the study, and it may even be the right study and it may even be the thing that needs to be done. There can be some resistance when you come in with knowledge that they don't have. And that's every doctor. There's not just veterinarians. You see this in the hospital when you meet a couple of surgeons who all thinks they're God and white. But it's a common thing in a profession to have there some resistance when a patient comes in and thinks they know more, because they probably don't. And most of the time they don't. But sometimes they may. So if you read a study or if you hear another opinion and you ask a vet about it, and he flat out rejects it and doesn't want to listen to you, doesn't even want to hear it and talk about it, that's probably an indication that that vet isn't willing to really be more like, what's the right word? Way to say it? Is interested in actually being a good vet for you, or care about you, or have a little bit of like customization for you. I mean, you can't change everything, but you can adjust what you're doing to an individual to some degree. And a vet who is not willing to even have a conversation about something that is relevant to this or maybe relevant to that, that's a red flag, right? That's any doctor. That's not unique to veterinarians. I mean, personal example. This is not vet related, but I have a wonderful ophthalmologist at UCI, and he is always happy to talk about anything regarding eyes. And if I read something about glaucoma or read something about new treatment or something or whatever, and he's always actually very well informed to begin with, but happy to talk about anything and give me his take on that. So that's always, I appreciate that. That to me is a great doctor. That's a doctor I appreciate. I'd like that from all of my doctors. I like this from a veterinarian as much as I'd like it from an ophthalmologist or my general practitioner. But yeah, so hope that was it. This was it. I didn't hope that was it. This was it. Oh, Ralph, it's late. So this was it. I hope that was helpful and you got something out of it. And I will see you next time. Bye.